Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine, and I'm the host for the Dean's Chat podcast. My guest today, Dr. David Alper, is a Board of Trustee member for the American Podiatric Medical Association. Welcome to the show, David.
Well, thank you very much, Jeffrey, and Happy New Year to you and everyone else out there.
Thank you so much. You know, David, I was toiling whether or not I should introduce you as the Kent State University College of Podiatric Medicine Hall of Famer, or introduce all the things you're doing with the ADA and the different wound care initiatives. But I thought we'd get started right away and talk about the American Podiatric Medical Association.
Sure. Near and dear and top of the list for me as well, too. It's been a 30-year climb to where I am now, and it's been absolutely a labor of passion and love, for not only for the profession, but for the people that you work with. And I could talk about it all day long, Jeffrey.
All right, well, let's get started. You know, also, Dr. Alper, let's go with first names, Jeff and David. Is that okay?
Absolutely.
Fantastic. So, you know, here at the college, we've got so many clubs, and we've got the American Podiatric Medical Students Association, and students are always wondering, you know, Dr. Jensen, what's the path to becoming a leader in this profession? So I think it's a great opportunity, you know, interfacing with you to kind of share your story on how you became a board of trustee, and a 30-year labor of love is a lot. And I was hoping you might share some wisdom with our students and audience.
Absolutely. Well, I'll give you the Reader's Digest version. I was very fortunate to come from Massachusetts, where there was a legacy of leadership. If you go back probably longer than most of your listeners would know, but there was a wonderful gentleman, Dr. Jack George, who was the past president of APMA, came from Massachusetts, and he selected his heir apparent, Dr. Lloyd Smith, because he firmly believed that he wanted Massachusetts to be front and center as far as the leadership of this country goes in the world of APMA. And so he brought Lloyd Smith in, and as time went by, Lloyd and Jack brought Mike King, another past president who I believe you've had on the show, and myself. And in this way, they brought us on initially as delegates to the House of Delegates that meets every year in March, which of course is the governing body of APMA. And it's really where you cut your teeth. It's where you get to see what committees do. You get to see what the Board of Trustees does. You get to kind of pull the curtain behind and see what's going on the day-to-day activities of the organization to really see if you have a taste for this type of work. And again, I was so fortunate to have these people in front of me to, first of all, select me. I was honored to do so, that they wanted me to follow in their footsteps, but also to guide me a little bit. And this happens in a lot of states. You know, I've learned over the years of being in the House of Delegates that a lot of delegations from small and large states really look for people that have, yes, a love of podiatry, but also those leadership chops. And hopefully we can groom them, we can entice them to join with us, to really give back just that much more. So that's really where I came from, that, you know, I needed to wait my turn to let Mike go through his 12, 13 years on the board. That was really okay with me. I had my children a little later in life, and so it allowed me to watch my kids grow up. And I finally came home one day and sat down at the family dinner table and said, okay, guys, are you okay with me doing this? I'm going to be gone a lot. It takes a lot of time. And they're all like, oh, thank God. What took you so long? So the family supports you as well, too. Then it's a matter of making sure that your state supports you, because you really want to have the rest of the delegation see that where you come from thinks you're the right guy for the job or woman for the job. Go to the House of Delegates. Hopefully you've made some friends in the years that you've been there. And it's also important that you're involved with the state politics as well, too. That's the other place where you cut your teeth, is not necessarily as president of the state, but certainly working with the board that keeps the states going, again, whether they're large or small, so that when you do finally join the Board of Trustees, you not only have a good sense of podiatry, of course, but you have a good sense of working on a board, you know, of the politics, of the actions, of the dedication, of the time, so that you know what you're getting yourself into. And that helped me quite a bit as well, too.
So, David, hopefully this is a worthwhile question. What's the difference in your mind between working at a state level and all the responsibilities with the state of Massachusetts versus working on a national level with APMA?
Well, one of the things that's unique about podiatry, and in some ways it's unfortunate it's unique about podiatry, is every state is different. So that when you're in Massachusetts, well, Massachusetts is a perfect example. We do not have the ankle scope as part of our bill. We cannot operate on ankles. There's only 2 states left, us and Mississippi. So the things we talk about with our legislative committee, with our advocacy committee, with our grassroots effort are completely different from California or Michigan or Texas. We can relate a little more to Alabama, who just recently got the ankle, thank God. When you sit on the board of trustees, you've got to broaden your mind to all of that. You've got to be ready to help, listen, congratulate, cajole everybody, because the problems are just such a unique pattern.
No, that makes sense. So when did you join the board of trustees with APMA, David?
I'm just finishing up my 6th year. I'm actually up for re-election again this March. Happy to accept any votes. Thank you. And that'll be another 3-year term. And typically we serve 9 terms in the board of trustees, assuming that the House feels you're worthy to be elected each time. Then you serve a year as treasurer. Then you serve a year as an incoming president, then immediate past president, and then you join the wonderful has-been club.
Well, then you get to get out and work and enjoy the fruits of your labor, hopefully, right?
Exactly. So it's of quite a commitment. Oh. And, when you add into the fact that I was in the House, as I say, for over 25 years before, and I'm not unique. I mean, it sounds like, oh my God, where did this guy come from? But, I can't think of a fellow board member that hasn't put in a couple of decades just like I have. It's just, it makes you valuable. It makes you know what you're talking about. It makes you really be able to approach the problem. And again, the other thing too, is it builds your skill set for working on a board.
Right. And it gives you perspective, wide perspective. That makes a lot of sense. So you're about halfway through, if provided you get elected and everything, you're about halfway through the process. What was eye-opening to you? What happened in the APMA Board of Trustees that, it's like, wow, I wasn't expecting that, or did you already kind of know what you were getting into?
Well, I was a little fortunate because I knew a little bit what I was getting into because of my fellow board members. I'll tell you, Jeffrey, one of the things that really amazes me, I'm fortunate to sit on a lot of boards in the medical community, and usually you're handpicked. You're nominated. You go through a vetting process. The APMA Board of Trustees are put together randomly.
Right.
The other trustees have no say of who's coming to play with them. They get elected by the House of Delegates. They get nominated accordingly, or they self-nominate. And so we have no idea what type of talent, what type of personality, and yet these are my second family. We have a board meeting tonight. I'm looking forward to it tremendously because I get to see my friends and colleagues and people I really respect. Wide range of personality, wide range of skill sets, of course, wide range from across the country. I have friends now in Arkansas and Texas and South Carolina and et cetera, et cetera. And the fact that we're able to work so well together, not always agree, which is a really good thing. But I think that was really the biggest surprise, is that purely by happenstance, this board comes together and works well. And as one piece falls off, another wonderful piece comes right on in again. So I think that, your listeners here should really take into account how well represented they really are. And I'm not saying that in a self-serving way. I look at the board from a distance, and it's really amazing that there are people there for everybody when it comes, again, to personality, to perspective, to style of practice. I was a solo practitioner for 36 years. We have other people that belong to large groups that are hospital-based. So you have that broad perspective as well, too. When our members, of course, have their own unique problems, there's an ear. And I think that helps quite a bit with it as well, too.
Yeah, that makes sense. And, I was talking to Dr. Bisbee, Brooke, and she was commenting on how you don't have to be in the high level of politics to get involved. You can get involved young when you're a student at the schools. When you're a young practitioner, you can get involved in committees. So there's lots of opportunity there for everybody.
Absolutely. And in fact, we desperately need it. We desperately need to continue to have, somebody's got to replace me someday.
Right.
And somebody needs to replace, people on the coding committee, people on the legislative committee, et cetera, et cetera. One of the things I'm proudest of, Jeffrey, which I'd love to talk about for a minute or two, I am honored to chair the Student Engagement Committee, which is a brand new committee for APMA. President Laura Pickard, previous President Laura Pickard, actually established this. And it's something that hopefully you're aware of at your school, that we are once again arranging for boards of trustee members to come to visit to the schools to introduce APMA to the students at the very beginning level.
It's so
and
smart.
you mentioned it earlier. It's fabulous. And you mentioned it earlier, they get hit with this alphabet soup of organizations, and where does APMA fall in this? And of course, every student has the ability to be a member of APMA. So as chair, I designated one board of trustee member per school to set up a visit to come tell their story. There's no canned speech. There's no, 50-slide PowerPoint. They get up there and say how they got where they were from day one. And then they open it up to Q&A. And the students have just been fabulous because they really see, exactly to your point, that this is the type of thing we need from leadership. And you don't have to go to the top of the food chain. You can sit on committees. You can do work in state. You can join the state organization. You don't have to go national. Absolutely. But they don't know until they hear it. And you deans have been so welcoming to let us come.
Oh, you're always welcome, of course.
Yeah. No. It's, we're taking some time from class time and et cetera, et cetera. But it has worked out. It's such an exciting committee for me. And the committee is made of a representative from each of the schools. So the students are really running this and organizing this. And when they come to your school and the other schools, we use that representative to help set up the meeting. I don't know the best pizza shop, and I don't know their schedule.
Of course.
You got to feed them, Jeffrey, or they won't come.
I'm with you on that. Well, APMSA is huge in all the schools. And, we had the APMA pack out here a couple months ago. We went on a big Golfina outing, and oh my gosh.
Sure.
And you're right. The students take over and run the whole show.
And it's fabulous because the students just feel so that much more comfortable. I know Dr. Kaplan has done that at several of the schools. I'm glad yours was one. I went to the one at the Ohio school, of course, and I did the student engagement up at the Philadelphia school with Dr. Mayachi. And we had 80, 90 students coming in. And afterwards, we broke up into little tiny groups. I got, names and phone numbers. I've heard from them email-wise. When you become a student, and I don't have to tell you this, when you become a student in podiatry, you want to be excited about your profession. It is one of the jobs of a trustee to keep that excitement going. And as I say, to create the leaders of the future. And this particular committee, and God bless Dr. Pickard for having the vision to create this, has just really run with it. And all my trustee members so look forward to it. It's a great time.
Oh, it's so fun. And it's really interesting because all the schools are so different, but they've all got the commonalities. And that's great. And I think that's really smart because, you know what they say, if you need something done, find somebody who's busy to do it for you. And our APMSA students are incredible. They're great students. They're great ambassadors for the profession. I just think it's a brilliant program. And I'm glad you guys are making it, getting out because it was hard during COVID, David. It was hard to get the doors
open.
Right.
That's exactly right. And, doing it by Zoom, I mean, we certainly can interact with the students that way. It's kind of a sandwich without meat on it. You really want to be there. You want them to hear you, smell you, see you laugh and see that you're human, that you're just like, it's hard for me to stand up in front of a room of 20-year-olds and say, you want to be like me someday. But, on the other hand, they can hear my stories.
Right.
They can hear Dr. DeHeer's stories, Dr. Bisbee's, Dr. Hughes, et cetera. Because we all came, as I said earlier, we all came from very different places, and we practice all very differently.
Yep, absolutely. So I have a question for you about being on the board. So you're head of the Student Engagement Committee. What other committees have you been on, and what did working with them entail?
Well, let me say, first of all, that we as Board of Trustee members rotate through the committees so that by the time you're president, you've had at least a taste of each of the committees. You have a little bit of an idea of what's going on broadly throughout the profession. I've been fortunate enough to sit on the coding committee for a couple of years. I'm not a coding guru, though I'm not too bad. but it's wonderful to see the battles you have with Medicare, with Aetna, with United Healthcare, et cetera, how we continue to fight for the profession, for the individuals to get reimbursed. So I've been on that committee. I've been on development, where, of course, we try to bring money in so that we can continue to support the things that we do. One of the committees that I really enjoy and I continue to sit on is the Clinical Practice Advisory Committee. And what that committee does is it helps each of the individual states with their individual problems of practice. So again, Massachusetts doesn't have the ankle in their scope of practice. Oregon just recently had their scope of practice challenged. We at APMA, through the CPAC, the CPA committee, were able to help them and assist them. With the staff we have, amazing staff, of course, with some dollars to be able to work, through advocacy and legislative wise. We also helped Alabama get their ankle bill. We're helping Mississippi get theirs. And so it's a very exciting group to be able to just go from state to state, unique problems. We hold a meeting once a year where we bring as many states as possible together so that everybody can network and say, how did you do this? Or, I'm having this problem. Can you help me? So I sit on that committee. I'm on the parity committee. I know that was kind of a hot topic over the last few years to try to see exactly where we can reach parity with our allopathic members, working through the white paper previously and now working through education changes, something that you're aware of sitting in the dean's position, that one of the recommendations out of our committee was to reevaluate the fourth year a little bit, maybe put a little more, general medicine into it so that our students are a little more prepared when they become residents, just as one example of the type of thing that we're talking about. There's also the legislative committee. I have not served on that yet, but truthfully, every board of trustee member is a member. We attend all the meetings because it's such a vitally important one. We have health policy, which goes along with exactly what podiatry does, where it fits into the world of medicine. Wow, what other ones am I thinking of? There are really so many. And then I also sit as a liaison to other medical societies. I'm the liaison to the American Diabetes Association, to the Society of Interventional Radiologists, so that when these other organizations have questions or if they have a meeting that I can attend. I sit on the board for the American Public Health Association as the podiatric liaison, certainly a very vital part of podiatry to let the world know that we are a part of public health as well as it is too. And then there are internal committees. I don't personally sit on those now, but we send a liaison to ACFAS, to ABPM, to ABFAS, to the AA, the Association for the Colleges, so that it's not so much that APMA comes in and says, listen, you have to do it this way, but that water flows both ways, right? That we know what's going on, that they know what's going on, that we can be there to help if need be. So these liaison positions are really putting the ears and the feet to what's going on in the world of podiatry and kind of brings it to one central point, whether we can help, whether they can help us, and et cetera.
Absolutely. It's amazing how much goes on behind the scenes. Things happen and you wonder how it happened. It's a lot of hard work by a lot of people.
Yeah, it really is. I mean, I think we have 24 committees. And of course, when you ask me, Jeffrey, what committees I saw, each committee has anywhere from 7 to 15 members. Right. So, we've got well over 100 good, dedicated podiatrists from all over the country that give their time and give their energy and give their knowledge to keep these committees going. I mean, the coding committee is one example. Talk about coding gurus. My God, we have some really bright people out there that just keep an eye on them, and God bless them, they can dive into the minutia better than I can. But, we were losing payment for the 25 modifier. Right. They saved that. That's money in every member's pocket. Every member's pocket. And this little group of people that 99% of the membership of APMA wouldn't even be able to tell you their names are doing this on a regular basis to keep the profession going in their little part of the world.
Yeah, that's just a case in point, isn't it? Wow. Mm-hmm. Let's talk about advocacy efforts. What's on the front burner right now for advocacy that you're aware of within APMA?
Well, again, we're trying to make sure that we get the best that we can in the way of scope of practice throughout the country. So at a state level, we're constantly monitoring to make sure that you're able to practice to the full extent of your education, that's not challenged and unfortunately gets challenged. There's a real issue with ancillary providers that PAs and NPs are doing or looking to do a lot of the work that we do. And it's an interesting thing, Jeffrey. You know, you talk about different parts of the country. There are some states that have podiatrists and podiatry organizations that embrace being able to bring NPs and PAs into their office to do some of this work. There are others that feel really quite threatened.
Right.
You know, that they're going out there, there are the foot care nurses that are doing our type of work, unsupervised by us. So once again, it really depends state by state of whether or not the members want to embrace this or not. And obviously, APMA has to go along with the will of the state. You know, we're not dictating to them. But that's something else that's really we're trying to advocate for as much as possible. Again, there's always coding issues. You know, we have to get down into the weeds. CMS, Medicare, of course, is the biggest one for that. There's also little things. You know, when COVID first came, why in the world couldn't we administer COVID vaccines?
Right.
I mean, for God's sakes, pharmacists were doing it. No offense to pharmacists. It was ridiculous. I mean, we give shots for everything in the world. Why in the world could we not give these injections? And so we made it a point that we can. Everybody knows now that you need to get the DEA MATE training for opioid dispensing. Well, they set up all these beautiful classes, and the government allowed the AMA, the ADA, all these others. They did not include APMA in a medical organization that was allowed to put a class like that together. We're working very hard at the federal level to change that. It's unfortunate we have to, but so that's where advocacy efforts are going into as well. There's the physician definition that we're constantly fighting to make sure that we hold on to that so that we are underneath the term physician. And interestingly, some states, including my home state of Massachusetts, the phrase surgeon is something that AMA is now trying to grasp onto, or mass medical in our case. So once again, we have to make sure that we fight. And that requires keeping your ear to the ground.
I was going to say you need to be proactive in those things.
You need to be constant. It's why we spend the money on lobbyists the way we do, because somebody's got to be watching this type of thing. And it's unfortunate with some of the small states, because something like this could creep through North Dakota, Wyoming, you know, even Brooks State of Arkansas, where you don't have a huge organization. You don't have an executive director. You don't have the money to keep alive. And that's where APMA can often come in, because we can fill in the gaps for them as well, too.
Very good. You know, I've done some recruitment for PAC, right? Trying to get docs to, you know, donate to the cause. And you know, there seems like there's a gap there because, like we were talking about, a lot goes on in the background. Not everybody's front and center. And it's not easy to raise money for a PAC, right? What would you say to our colleagues when it comes to our efforts legislatively for advocacy in terms of giving to the PAC? I think it's probably every dollar you get back 10 in return. But what are your thoughts on that, Dave?
Well, first of all, and it's an excellent question, Jeffrey, because it's hard. And I'll be honest with you, nobody dislikes asking for money more than I do. I'd rather just write a check than ask you to make it out of your pocket. You have to put politics aside, and you have to focus on what's best for podiatry. I'll give you a perfect example. Many of you know that we have a podiatrist in Congress, you know, Congressman Brad Wenstrup, you know, dyed-in-the-wool Republican from a Republican state. His political views are not necessarily mine when it comes to many things. That doesn't matter. I donate to Brad's campaign every time it comes up, because a podiatrist in Congress, oh my God, you can't put a dollar sign on that. So when people come to me and say, I can't give you money for this guy, I don't support what he's believing. Well, yes, you do, because you're a podiatrist and he's a podiatrist. And that's the end of the game. And that's the reality you have to face. So I would say the message that you have to do, that you have to bring when you go to people to ask for money is, you're not giving money for Democrats, you're not giving money for Republicans, you're not giving money for independents, you're giving money for your profession. And whoever is sitting in that chair, red, blue, purple, green, whatever you want them to love what you do and the people that do it.
Absolutely.
And that's where the money comes through. So, and that to me is one of the hardest things, because you get that pushback all the time. You know, I've been a Democrat for years. I can't give to a Republican. Well, you're not giving to a Republican. You're giving to someone that supports your livelihood, your profession, and your colleagues. And that's what you need.
Well said. And Randy Kaplan has reiterated very similar thoughts. And I agree with that. I mean, if we're talking about the very livelihood of a profession. We're talking about food on the table. We're talking about getting reimbursed for services that we render. Top priority for the profession.
Yeah.
No doubt.
Yeah. I mean, Brad Wenstrup went to the mats and got us equity and pay at the VA.
Right.
That was, and for those of you that don't know, podiatrists were not rated the same as allopathic doctors when it came to pay scale, when it came to promotions. And of course, promotions in the military. I mean, that's what it's all about. And they have that now. They have that parity. And we had Congressman Wenstrup carrying that through the halls. That's incredibly invaluable. Incredibly invaluable. And for us not to support his campaign to make sure that he continues to sit there, yeah.
Well, we're going to miss him when he retires here.
Yes, I wasn't going to mention that, but yes, you are correct. It's going to, but I mean, Jeffrey, new career for you. There you go.
Well, there you go. Well, I remember talking to Lee. Remember Lee was running for.
Yeah, he ran in California.
Position. Yeah, he ran a couple times, and I kept telling him, Lee, three times is the charm. You got to go for it. Well, that's fabulous. So what do you see in the near future for APMA? I know we're going through some changes, right? Dr. Christine is stepping down. And so it's a time of change.
It's an exciting time.
Yep.
Dr. Christina did a wonderful job leading us through some very tough times. I mean, you want to talk about a ship on high waves. I mean, taking us through COVID, where we couldn't meet, we didn't organize, we as a board voted not to collect dues for one quarter, right. Huge monetary hit, but so valuable for the profession.
Right.
So he was the right man for the job at the right time. And now it's time for the next right man, just like Glenn Gatsworth was for many years. Frank Maloff, I don't know if you go that far back, but Frank before him. And it's always nervous and exciting when you have new leadership. It is. And along with that, of course, we just sold the building, which was a very positive mood. I know most people haven't seen the building. It's a shame because it was a wonderful, wonderful symbol of the profession. I mean, you really kind of took your breath away a little bit when you walked in, and it was everything podiatry. But fiscally, a great move. With as everybody knows, the cost of rents for business space is way down. We are saving thousands and thousands of dollars, aside from getting good money for a building we bought over 20 years ago. But that type of upheaval is a little rough, not only on the board, but on staff as well. These types of changes. The staff, of course, is involved with the COVID world, and we have a lot of remote work as well as a lot of in-person work. And there's a continual balance for that, a certain amount of days in the office and out. And again, not unique to podiatry, just with that. I think the biggest goals that we're trying to work for now in the future is not only to finish the MAP, Mississippi and Massachusetts for the ankle, but we're starting to really focus on nationwide scopes of practice, nationwide practice acts, just like every other medical profession. If you're a gastroenterologist, you can pass a tube in any state you're in. Nobody questions it. Right. But when you go to a state as a podiatrist, the first thing you got to do is check and see what you can do and what you can't do. Can you go up to the tibial tuberosity, or do you got to stop at the talus? I mean, so we're really trying to look into that. We're continuing to look at a little bit of education reform, as we spoke about earlier, again, to make sure that our students and our residents really do feel parity. They, when they start as a resident, they really do feel that they can go shoulder to shoulder with their allopathic colleagues. Very, very important, especially at the beginning. And of course, practice is changing, Jeffrey. And when you and I got out, I mean, one of the reasons I went into podiatry is I wanted to be my own boss. And I opened up, cold. My first week, I think I had 3 patients, and I was thrilled to have 2 of them. Kids don't come out of school nowadays like that. They can't. Their indebtedness is so large that they need the paycheck day one. So we are now becoming a profession of large practices, the groups like Upperline and US FASMA that are munching practices and making this nationwide organization. Not a bad thing. not a bad thing necessarily, but we need to change our focus, and APMA needs to change their focus as well, too. Membership recruitment is always something on the minds of APMA. Well, now we don't go to Jeffrey Jensen and say, join APMA. Now we go to Upperline and say, we want your 200 podiatrists as members.
Right. And
here's the value to your organization. And then we have to go to the individual podiatrist and say, you need to advocate for your membership to your profession's organization. And so it's a very different approach than it was even 10 years ago.
You took the words right out of my mouth. 10, 12 years ago, I remember meeting with one of my classes. And, we're talking about the future. And I asked them point blank, what do you want out of a career? And I was thinking, private practice, own my own practice, have the control of my own schedule. But almost universally, everybody wants a job. They want their vacation time. They want a steady paycheck. And so that changed. And now you see more and more docs employed by hospitals, more and more opportunities. So it's a sea change. You're absolutely right. And I can imagine it's a challenge for APMA with membership issues and things.
And maybe they're smarter than us. I mean, the catchphrase work-life balance is something you hear all the time. You and I didn't have that, and our classmates didn't have that as much either. We went out and we just worked.
Right.
And I'm not saying we weren't devoted to our families. We weren't as devoted to ourselves as much, maybe.
There you go.
which is a difference. But the point of the story is that they're seeing some things in their work lives that I don't think we did. We need to recognize that. We need to recognize that. And we need to recognize that they're not completely masters of their own domain, whether it becomes being a member of APMA, when it becomes here's a perfect example. Can you imagine me as a Board of Trustee member working for Upperline or US FASMA, having to ask permission to take off to go to the House of Delegates, to go to the annual meeting, to go to quarterly board meetings? That's time out of the office.
Right. No, it's pulling. It's like a little tug of war going on there. But people are adapting, and I think it's good for the profession, because now you can make a choice. You could get a institutional job if you want, or you can still have a private practice. So I think there's a lot of shakedown yet, but I think it's all good for the profession. I really do.
It absolutely. And once again, to circle back, it's why these visits of the trustees to your schools is so vital. Yes. Because they can hear how we made our choices and how the choices worked out.
Absolutely.
You take someone, I know you had Dr. Hughes on the show. He's now part of US FASMA, but he was a solo guy who started like you and I did originally. He can talk about the transition, what was going through his mind that made him decide to do that.
Absolutely.
So.
No, it's a lot of changes going on, but I think it's good for our profession. Absolutely.
Absolutely.
And you know what? Through all this change, I think it's good to have stability on the Board of Trustees. So kudos to you and your board members.
Well, thank you for that. Like I said, we wouldn't want to leave just because we like each other so much. It's really amazing how you get somebody new we just had Dr. Bob Sage come in from Wisconsin. I knew Bob a little bit from the House of Delegates because he's been there from Wisconsin for a while. I love spending time with Bob. It's amazing to me the energy he brings, the unique perspective that he brings from practicing in a part of the country I don't know.
Right.
And how valuable to bring it to the Board of Trustees, And meanwhile, Dr. Jeff DeSantis rolled off, after all those years. California perspective, huge multi-doctor practice, very different way of practicing than I did. Right. Very different perspectives. And yet Jeff and I will be friends for the rest of our lives.
Absolutely. No, that happens. That's great, because when people are passionate and they're giving their time and energy and they're committed, how can you not develop those bonds that last a lifetime, right?
Well, that's it. And that is the one common thread, is you have people that are dedicated to their profession and their workers.
Absolutely.
That's what people, with all the differences that we have, it's that common thread that really pulls us together. And then it's just mutual respect to be able to disagree and still agree.
You know what? It's healthy to disagree sometimes for the organization. And, everybody has their fiduciary responsibilities, and it makes sense. So, David, thank you for all you do for the profession. Can we shift gears? I want to talk about some of the other neat things you're doing.
I would be thrilled to. It's an exciting part of my life, Jeffrey.
So I've worked a lot with the Wound Care Alliance, the Alliance for Wound Care Stakeholders, and Marcia Nusgaard and her team. And you're a member of that board. How'd you get involved, and what are front burner items on for the stakeholders for wound care?
Well, for those of your listeners that don't know, this is a complete advocacy and legislative organization. Marcia is a force to be reckoned with. And when she opens up a door down in Washington, D.C., people definitely run for a chair and a cup of coffee for her. But what she does is she focuses on anything legislative. And when I say she, of course, I mean the organization, anything legislative dealing with wound care. So a perfect example. The Alliance for the Wound Care Stakeholders was vital in shooting down CMS's attempt of getting all skin substitutes under one code and one reimbursement, which would have just devastated not only that part of our profession, but my God, the treatment for people with ulcerations, with wounds that need this type of care. Absolutely. And they went there to bat, and I will state it categorically. It was because of their efforts that CMS pulled that back. Now, part of their efforts was to come to APMA, was to come to ADA, was to come to the CLI group, was to come to the National Pressure Injury Organization and pull all these people together, right? So that they walk in with a folder full of letters, full of evidence of the whole 9 yards and the relationships that they have. I was very fortunate, and we are very fortunate, because the chairman of the board of Marcia's organization is Dr. Matt Garafolis, right, who is a podiatrist. Absolutely. And so they recognized from day one, and partially because of Matt's efforts, the value of having podiatry at the table. Absolutely. And so I am the yes, I think probably, they heard about me with some of my other work, but they want a podiatrist there. They want somebody to bring the podiatric view, as well as vascular people, interventional radiologists and cardiologists, dermatologists, et cetera, so that you get the full broad perspective. Yep. And this is what is so vital, is to have that podiatry presence at the table.
Oh, I so agree. I've been to Baltimore a few times with FDA and some of the coding things with CMS, and it's just incredible because that stakeholder group has the ability to reach out and get help. And like you said, Marcia's a force. She can get support from any group within anybody has anything to do with wound care, and really put together in a very timely fashion a compelling argument, as you said, like with the skin substitutes. So kudos to you for working with them. That's a great opportunity.
Well, thank you. And it's strange bedfellows, because she also brings in people from industry. Right. She has Pericles there. She has Organogenesis at the table. We often have people from the FDA attending our meetings that are willing to sit there and take our abuse a little bit, and always politely, of course. But to make sure that they hear what we're talking about. And one of the ways that Marcia and I got together is that we wound up sitting next to each other at other organization board meetings. So I've been on the board of the American Diabetes Association for over 30 years. And we've had several, especially now with amputation prevention, we've had several national meetings, and who's sitting at the table across from me but Marcia, often with Matt. Yeah. And so you start to talk, you start to hear what each other is doing, and it's like, maybe we should play together. And
makes sense. And the amputation prevention thing is so interesting, because it's one thing to heal a wound. It's another thing to keep it healed, right? So there's a lot of players involved, and everybody doing a great job in representing their respective professions and specialties. And it's fun to see people working together.
Well, and I have to tell you, Jeffrey, one of the nicest things that not only happened in 2023, but really in my career of podiatry, I was asked to speak at a CLI Foundation meeting out in, you're in El Paso, Texas.
Yeah, with Adrian, right?
That's right. With Adrian and Dr. Raja and Laurie Henderson, et cetera.
Right.
My opportunity to go to El Paso, who knew, had some great Mexican food. And what it was bringing all the players that deal with CLI patients into the room.
Right.
To realize and to discuss making teams, because what's recognized is that CLI patients need a team, from the PCP to the cardiologist, to the interventionalist, to the wound care nurse, etc. And I was asked to speak on the role of podiatry. And I have to tell you, I walked into the room, 150 medical professionals in this room, all focused on CLI.
Right.
Thrilled to have a podiatrist there. Not David Alper. Most of them had no idea who I was. It was the podiatry part of it and the Q&A of the role of podiatry. And one of the things I was able to do, which I was so thrilled, is I took 2 minutes out of my talk to talk about who your friend the podiatrist is.
Right.
So I could speak about our education, the 4-4-3 model. I could speak about the fact that, the toenail cutting is back in Zachary's day. Get that out of your mind.
Right.
And most importantly, we are vital because we're the gatekeepers. We're the ones that see these people. Mr. Interventionalist, we're going to fill your waiting room because we are the ones that pick up that they need to see you. And by the way, send that wound back to us because you don't want to treat that wound. That's what we do. And they recognize that, Jeffrey.
Absolutely.
I will tell you that not only did I spoke for 20 minutes, I had 30 minutes of Q&A that got cut off. And afterwards, I was approached by an enormous amount of people that were asking basic questions like, how do I find a podiatrist to refer to?
Right.
Where do I go to make sure that I have the podiatrist as part of my team? And since you're familiar with the folks out there, you know that the podiatrists out there are central to what they do.
Absolutely.
This is so vital for our profession. So vital. We are welcomed. We are recognized for what we do. Our niche is ours. This isn't fighting orthopedists for bunions. Right. This is wound care. This is picking up on PAD, on CLI, on amputation prevention. We belong there.
Absolutely.
And we are welcome there. And if you want to feel good about your profession, boy, just attend one of these meetings and see how welcome you are.
Absolutely. Well, you're an incredible ambassador for the profession, David. I love it.
Oh, well, thank you. No, I appreciate that. It's so exciting. It's so exciting to see us. We all went through especially the early years of having to defend who we were and having to defend our training and to be as welcome as we are now, to be as welcome. Amputation prevention, when ADA put together the Amputation Prevention Alliance, and I was honored to be one of the founding members of the clinical advisory, they had a list of who they wanted there. And once again, it wasn't necessarily David Alper. It was a podiatrist. They needed to have a podiatrist as part, and everybody recognizes it.
Absolutely.
Everybody recognizes it. And they recognize that we're the ones that are going to pick up on it early. And when all is said and done and that limb is saved, who's going to keep an eye on it to make sure it stays that way? Who do they see 5 times a year? Not their PCP, not their cardiologist.
Yep. The podiatrist is the quarterback. Yeah, I'm with you. Let me shift gears a little bit, David.
Sure.
I wanted to ask you about your Hall of Fame induction into the Kent State University's College of Podiatric Medicine. Congratulations. That's incredible.
Well, thank you. That now you're embarrassing me a little bit. Well, I think, I'm not sure, but I think most of the schools have something of a way of honoring alumni, which they should.
Right.
Which they should. Everybody does the good work that we do for the right reasons. It's always nice to acknowledge people for contributions they make. And I will tell you, I attended the one up in Chicago when they honored Laura Pickard for her dedication to the profession. I mean, obviously as a president, et cetera, and there have been others. I have sat on the board of advisors of Kent State University for about 7-8 years now, and I also sit on their clinical advisory board. It's a wonderful opportunity to give back to the school. I will tell your listeners, boy, if there's no place else you want to put your energies, I know I'm singing to the choir here, but giving back to the people that gave you your life, gave you your livelihood is a wonderful thing, and you don't have to just write a check. But I've been dedicated to Kent State. I've been dedicated, the old OCPM, as I still call it occasionally. And I guess what they saw was somebody that not only continues to be involved with the school, but took what the school gave them and kind of ran with it a little bit. And so when Dr. Boyk, the dean of the school, gave me the call, it was an incredibly pleasant surprise. They don't let you know it's coming. They have an alumni weekend, which is actually tremendous because Friday night, it's a wonderful idea because they bring as many alumni as they can together to the school, and they have an event for the alumni and the students. And it's just, I don't even want to call it a networking because it's not even that organized. They usually take over a beer hall somewhere. And so everybody's drinking, everybody's eating. They actually had it in like a bowling alley one year and everybody was bowling together. But you get to interact with the students again. And then Saturday, they have this beautiful event where they usually induct 2 every year, as well as a couple of other awards given to both alumni and students, give out some beautiful scholarships. Again, I assume you have something similar at your school. And I was given an opportunity to address the students, which was equally as much fun. So
that's incredible. Congratulations. That's great.
Well, thank you. Now my face hangs in bronze on a true hall. They actually do have a hallway with. It's a little weird because it sort of seems like something that should be posthumously, that you kind of walk there and it's like, oh, well, here's some kid looking saying, who the heck is this?
Right.
But I'm there with some really, I think one of the biggest honors is the people I share the wall with,
right,
because there are some absolute movers and shakers of our profession that came out of OCPM that I'm honored to be associated with. So thank you for bringing that up, Jeffrey. That was nice of you.
You're welcome. One last thing I wanted to ask, you're a busy guy. You give so much back to the profession. What do you do for fun? What do you and your family like to do to recharge the battery and maybe take a break from podiatry once in a while?
Well, for starters, I have the best dog in the universe. I know other people would argue with me, but I have my fabulous little Shih Tzu Gizmo. And one of the joys of retirement, not having to go to the office, is I get to walk him 2, 3, 4 times a day, as well as play a lot of ball and give a lot of belly rubs. Like a lot of people, I like to dive into nature. I am fortunate enough to have a cabin up in the backwoods of Maine. So in the summertime, my wife and I and the kids, if they're available, can to run up there with us. And it's a town of 400 people with 1 general store and 2 churches, and that's it. So you really get off the grid a little bit, which is kind of fun. I have an interesting side hobby.
Yeah.
I blacksmith.
I'm sorry?
I blacksmith.
You are?
Yeah. Now, it's not a second career. I'm not, you don't see me on Forged in Fire, and I'm not making running fences. I make candlesticks. I make knives. I make, decorative things. I did make a chandelier for our house. It's the anvil and heating the metal and banging it with it's the antithesis of what we do, because rather than the fine, delicate work, I can sit there and just whack away and get out all those. So it's kind of my little escape a little bit that I enjoy doing with that. And it's funny because I travel so much for the boards that I have. And yet, like many people, I love traveling with my wife. Last year we were in Dubai. We did the west coast of Oregon, and we were down in your neck of the woods, actually. We attended a wedding in Austin and Houston, and so we traveled around there a little bit, unfortunately in June, but we were down there anyway.
Well, if you come, you're always welcome in Arizona, Dave. I mean, you're always welcome. Just don't come in the summer. It's too hot. I mean, you're seeing me in a vest. It was 38 degrees this morning in Phoenix. So, but
I have to tell you, I drove across country last January, and I took the southern route because I didn't want to get stuck in Colorado in the snow. And one of the places that seemed like a good place to stop was Flagstaff.
Oh, yeah.
Yeah. Nobody told me that I was going to be driving through 8 inches of snow, driving me into the side of the road. I'm like, wait a minute.
Arizona's got it all, David.
Little bit of everything. My son's looking at me like, Dad, why didn't you know this? I'm like,
right. Oh my God.
I don't know. It's Flagstaff skiing. Who knew?
Yeah. So, yeah. I mean, that's one of, you can go to the Grand Canyon, go skiing, you can go to Mexico, 3 hours to the Gulf. I mean, there's a lot of opportunities. So that's fabulous. Well, David, we're running a little bit short on time. I wanted to thank you for your career of service to the profession and all the great things you're currently doing on all the boards, especially in the wound care space. It's so needed. And thank you for representing our wonderful profession.
Well, thank you so much for inviting me, Jeffrey. It really is an honor to be joining so many of the people that you spoke. And thank you for doing this, for putting podiatry front and center in such a positive light for our colleagues, our students, and the public at large. I think this is just something we needed, and I hope you just keep doing it for years to come.
Well, I appreciate it, David. Thank you. And just so you can remember our time together, I'm going to send you a Dean's Chat cup so you can drink coffee.
There we go. You can see I'm a drinker, so
got to take your coffee seriously.
I will use it with honor and pleasure.
Sounds good. Well, thank you again. And to all of our listeners, if you're listening on Spotify or Apple Podcast, please give us a 5-star rating. And if you're watching on YouTube, we'd really appreciate it if you become a subscriber. So, David, again, thank you so much. And cheers, everybody.
Happy, healthy New Year to you all.
Likewise. Bye-bye now.